We're going to start it different today. It's the catch-up because we don't, this isn't so formal. It's not often that we do actually get to catch up because life is busy and there's many things going on in our lives. And, yeah, it's like a little bit of a peek behind the curtain.
Contrary to popular belief, we don't actually spend a lot of time together.
We don't.
People ask, you guys train together all the time and shit?
Not so much. Not so much. I guess it's like we have ebbs and flows of that. Sometimes we train more. Sometimes we don't. But I guess it's one of those things that, like many things in life, you do your own thing. And the cool thing I think about that is we're able to bring different perspectives in. So it's not just the same old thing. And recently, Joe, tell me about your knee, man. What's going on?
Oh, well, I just, it's interesting how many people get in touch about knee injuries.
Yes.
And I think a lot of folks, that follow us know that I had my own ACL Rico and stuff.
Yes, sir.
That was, like, for those who are hearing this for the first time, it was like 3 years ago, I guess. It was in November. It was sometime in November. Snapped my ACL, did a bit of damage to my meniscus. So I had a reconstruction surgically and whatnot.
Yes.
I don't know. That was a couple months after the injury. But fuck, it's just so common in jits.
Yeah.
And so people are reaching out like, well, actually, I should phrase that differently. Some people reaching out, but I'm also just seeing a lot of people, you're catching someone on Instagram and they're like, oh, going in for surgery or it's ruptured. They post a picture, like a story of their MRI or something.
You see the person with their leg up in hospital.
Yeah, and you're like,
just
oh shit, what happened? They're like, oh, jits,
Yeah, jits life.
So, I always try to, I guess I try to share some reflections on it.
Yes.
And the kind of one of the main ones is like really take the decision to have surgery like very seriously.
Yep.
Because there are big ramifications of going through that. And definitely for me, like the surgery, that experience itself was fine. The rehab period after was fine. But it's just the fact that like you've got to really, and it's different for every person. I should preface this with, some people will experience totally different things to what I have.
So you had an ACL reconstruction.
That's right.
Which is very specific compared to, say, someone who's had like a meniscus tear and had part of their meniscus removed. Yours was very specifically ACL reconstruction.
That's right.
Right.
Yeah. So ACL reconstruction, which, all right, so I'll give a bit of context on this.
Yes.
When you get a Rico done, they can rebuild your ACL from generally either the patella tendon, which is at the front of the knee,
yes,
or the hamstring tendon.
The meatiest of hamstrings.
Right. So I got reasonable hammies. And so the surgeon was like, oh, we're going in the back.
Don't talk it down. Don't talk it down. Joe has the meatiest hamstrings his surgeon has ever seen.
That's right. He said, oh, man, there's some. What do you say? Did you say meaty?
I believe
so.
No,
monster.
Monster.
There's some monster hamstrings. Irish lad. Shout out.
He's like, would you like a hamstring reduction? Yeah. Just shave a bit off. Make
Could we just lift them a little bit?
Tuck under the butt a bit.
But so generally they do that. They will choose based on whatever we've got good amount of tissue of. But also I think the patella tendon is if you do anything that involves you putting pressure on the front of your knees, like kneeling,
yes,
like jiu-jitsu, it's not ideal to have that because you'll end up with funny sensations and maybe a bit of discomfort. So they take it from the back. It's just like better in the long term. So anyway, they cut like a long strip of the tendon. And then they fold that over, I think, 2 times.
Oh, wow.
So you end up with like 4 strands.
Oh, wow.
And that goes on like the surgical table. That's your soon-to-be ACL.
Oh, wow.
And then they go into the knee, and then they so the ACL is like this little ligament, right, between the lower leg and the upper leg, right? So you got like 5 different. I think you got 5 in the knee, right?
So yep.
Yeah, about that. ACL is this little one on the inside, but it's really important. It's really responsible for like rotation. So in any case, that snapped, right? So what they do is they go in and they drill a hole through the top leg bone, and then they drill a hole through the bottom leg bone, and through those holes they pass their new little ligament, and then they anchor it at both ends.
Oh, wow.
Nice and tight.
Wow.
That's the idea, right? It's pretty straightforward. So they did that, and then they also did some repair to my meniscus, which got a bit damaged at the same time. It had kind of lifted up a little bit, so they like stitched that back down into the bone somehow.
Yeah, wow.
So anyway, they rebuild the thing. So, you know what I guess the way I kind of think about it is like, I don't know if for the listeners, for yourself, if you've ever taken a door off, like a door frame.
Yes.
So you undo the screws at the hinges and you pull it off, to paint it or whatever. And then you try to put it back on. It's not that easy to put it back on,
Not at all.
It never goes back on exactly the same way.
No.
And there's just this natural sort of ergonomic nature to things that fit together. And, you look at the way your body evolves, everything of the size of the ligament, the length, the thickness, the shape of the inner surfaces of the knee. It's all very organic, and it all happens, as you grow from this little fucking single cell thing into the human you are.
Yeah.
So when they go in there and start just rebuilding the shit, it's very different.
Yes.
So the experience I had was my knee was super tight, and you would remember this.
Yeah. Well, let me cut in here. Just for reference out there, I remember us talking about it because we were chatting before the surgery. And this is the thing which I think people really have to take on board, which the surgeon isn't going to tell you, maybe, right? The surgery itself is trauma. So Joey was like, I'll get the surgery. I'll sit with my leg up. I'll become the admin king, get heaps of stuff done. It didn't quite play out that way, did it, J-Dub?
No, definitely not. Like the
pain.
The pain was a real consideration.
It just didn't go away, right? Like it was just aching.
Oh, it hurt heaps, and it was like, it was a level of pain I was not accustomed to.
Yes,
and it went for a period of time that I was like, fuck me, I didn't think that 6 weeks after the surgery I'd still be in pain.
It's distracting.
Yeah, absolutely. You can't do it. Like you can do stuff, but you're just not effective. Yeah, I was like, oh man, I'll be creating YouTube content and fucking spamming Instagram and shit. It's like, nah, dude, you'll be on the couch like in a bit of a daze. Yeah, maybe you get a bit of work done, whatever. But you're out and about. Like I was walking and shit by that time and coaching and stuff. But yeah, you're not like performing at 100%.
No,
mentally. But in any case, like. Yeah, what I realized was that, or what happened was immediately kind of after the surgery, surgeon says, hey, we've done a really good job. Mm-hmm. I don't think surgeons ever wrap up a surgery and say, hey, we didn't do a really good job.
We did a shit one.
Yeah.
You may be my worst surgery ever.
You got the short straw.
That's how it goes.
Come back next time.
Sorry.
So on that, so they're like, yeah, we fucking nailed it.
Of course.
Your knee's perfect. But my knee was super tight, so I couldn't extend it properly, and I couldn't extend it all the way. So you might see, if you look at our content from that period, like on YouTube or on Instagram, anytime I'm doing like Cossack squats and stuff, one leg locks out real nice, and the other one looks like it's just a little bit kinked.
Not quite.
The whole time, yeah. I'm really trying, guys.
Yeah, sure.
But so you lose mobility in the thing. And the surgeons say like, hey, you need to really work hard on getting your extension and flexion back. Like as soon as we finish the surgery, like that's your goal. He was most focused on the extension. Anyway, I worked the fuck out of it, improved a lot, but didn't improve fully. Like I had a knee that was tight and stiff. So I went back in for a checkup with him. COVID happened at around this time. So I was meant to see him 6 months after. I saw him 9 months after. And by this time I'm back at jiu-jitsu and doing all that stuff, lifting, whatever, like that. It was really only sort of, 6 to 12 weeks where you're kind of a bit incapacitated.
Yep.
And I limped into the office, and he was like, what are you limping for? I'm like, I trained jiu-jitsu last night. Like I always limp the next day because my knee's just a bit sore.
Yeah.
And he's like, well, that shouldn't be the case. Not at this point, not 9 months later. And so he kind of, had a couple of tests. He said, yeah, I think we need to go in there and shave a little bit off that ligament.
It was too thick, wasn't it?
Too thick.
Dang.
My fucking hammies bit me.
Too meaty.
Too fucking,
God damn it.
Right? Everyone wants the monster hammies. Guys, let me tell you, it comes with big responsibilities. Yeah. There are downsides.
True.
So I had a second surgery, which, long story short, that was kind of like the whole thing all over again.
Puts you back a bit.
It does. Same kind of trauma, same kind of painkillers, same like sort of 3-month recovery thing. Bit disappointing, but what are you going to do? I definitely had more range like instantly after that.
Yep.
And what he said was that they built the ligament. It was quite thick. And so they just wanted to shave a bit off. It would create some space in the joint.
Yes.
Makes sense.
Yes.
So in any case, I went back to see the surgeon. I think I got another MRI done because it's been 3 years now. Mm-hmm. And earlier this year, I'm like, I'm not happy with it. Like it's just, I have a stiff knee. And for me, I've always had good squat mobility.
Yep.
Been able to sit like, kneel on my shins, that whole thing. Yep. I can't do that anymore on that leg. And I'm not really complaining, but it's just, it's more to point out like movements that you could once do, you just can't do them now.
Yes.
Right? So I went back to see the surgeon and I'm like, look, I'm not happy with this. I would really like to be able to kneel again and comfortable, and just not have the discomfort when I get into the bottom of that squat. And, he was very upfront. He's like, look, it's in great shape. You've got fantastic mobility. And he's obviously basing that off like everyone else,
people,
right?
Yeah.
And he's like, if I went in there again, I couldn't improve anything. He's like, I would actually refuse to go in there again because we're going to create more trauma.
Could make it worse.
And it's just unnecessary because he said, I can't even improve it.
Wow.
So I was like, well, fair enough. Appreciate that. The honesty, whatever. Great. But so here's the thing, right? Here's the rub that I try to tell people. It's like, hey, look, the surgeon and surgeons always get a bit of a bad rap.
Sure.
From anyone kind of in the know because the surgeons want to do the surgery, right?
Yeah,
that's their bread and butter.
That's their money.
Yeah, that's what they do. Hey, I'm a knee surgeon. So when you go to a knee surgeon, if they believe that by doing a surgery they can give you some improvement,
then
they're going to recommend surgery.
Of course.
Right? But the surgeon also doesn't have to live with your knee for the rest of its life.
That's right.
Or your hip or your elbow, whatever it is.
Of course.
And I and this is like respectfully because I do respect the work they do and I respect the surgeon that I had. There might be a surgeon listening to this, but the surgeons are also trained to be myopic when it comes to what it is they do on a daily basis. So if you're a knee surgeon, you study knees and you do surgery on knees and you are looking at knees and talking about knees and looking at MRIs of knees, all day long, your whole career. That's the thing. So, and this just naturally happens when we specialize in any field. The blinders go on and we become really zeroed in on that thing. So from the surgeon's point of view, I've got a perfect ACL.
Yes.
The surgeon's point of view, that thing's not going to snap again. That's strong as fuck.
Yeah.
But from the general view of me as someone who wants to move well, and I'm like, oh, fuck, my knee's a bit stiff.
Yeah.
Sure, it's strong. It's not going to break again, but I can't move. I'm a bit uncoordinated, a bit, I feel like an old man on that side.
Yeah.
So that's why I try to tell folks is like, hey, there's a trade-off here. And it may not be the case that, some people might just go back to where they were. Like they might just return to their baseline.
Yep.
But I would think that most people will experience some kind of, say it, don't spray it, bro. I think that most people would experience some kind of sort of lingering effect as a result of that.
Definitely. And I think this is the thing that they don't tell you, that obviously quality of life is up to you, but really every time you go under the knife, it's increasing, the hope is that it improves your current state, whether it's surgery on organs, on your ligaments, on soft tissues, whatever it might be. But it doesn't mean you're going to go back to where you were. Like that's a real misconception. Oh, I do this and then I'm straight back to 100%.
Yeah.
No.
Yeah.
And that's a serious consideration.
It's, going through, my partner gave birth to our son. It's the same thing I learned with pregnancy, obviously, but it wasn't apparent to me sort of as a male.
Yes.
But also just not experiencing that before was that, there's a lot of talk about like after women have a baby about like getting back to their pre-baby body.
Sure.
And I learned like that doesn't exist. Like the woman's body is changing. Like after it's given birth, things are just different.
Yes.
So it's the same kind of idea there, right? Whether there's surgical intervention or not.
Yes.
It's like, hey, your body's gone through some trauma or it's gone through some changes. It's going to be different.
Yeah.
And that could be for better or for worse.
Sure.
But I think it's really important to realize things will change. Yeah. And if you're kind of expecting that, I'm going to get back to where I was and then it's just fucking gains from there, it can be a bit disappointing.
It's an illusion.
Yeah. So I think something that I sort of throw around in my mind now is, would I still have the surgery if I knew what I was going to feel now? And the trade-off there was that there was an option to not have surgery, which I discussed with my physio and with that surgeon. Mm-hmm. And they said, look, you would be a good candidate for it. You could do it. I think I've mentioned this to you before because the rest of the shit around the knee was strong.
That's good.
But he said, without an ACL, the rest of your knee's going to have to work quite hard, and particularly your meniscus on this side. And he's like, that's where you've got damage. So he's like, I reckon you'll probably be back. If you don't do it, I reckon you'll be back in here in 5 years' time with a fucked up meniscus. And he goes, we don't want that. He's like, we'll probably have just to rip the whole thing out.
Yeah.
So I was like, all right, I'll take your advice on this one. And so, so in that regard, like there's no regrets.
Yeah.
But important thing to think about.
You got to consider it.
Now, just on the knee thing, something, and this is really important to mention. Dr. Kickass.
Yes.
He talks about knees. He's, a lot of the like the injury folks, people on in the jiu-jitsu scene and whatnot. There's a guy. So I had a lot of my rehab done with Justin Lang, who's a real knee. He's an exercise physiologist, real specialist when it comes to knee rehab here in Sydney, down in the Carrying Bar. Shout out to Justin Lang.
Shout out.
Yeah, I really respect that guy and appreciate the work we did together. Live Athletic is the name of his gym. But he was telling me about Tom Cross, who's here in Sydney, in the city, who is I think he's a physio. And interestingly, Tom Cross's father, Merv Cross, is one of the godfathers of Australian knee surgery.
Knee surgery, yes.
Yeah. So he's been doing knee surgeries for many, many years. Tom Cross, the son, who's a man and an adult, he has pioneered this non-surgical repair for ACLs, and it's called the bracing strategy. And basically, what the idea is, they brace your knee at 90 degrees, and they pretty much keep it there in that position roughly for 12 weeks. And it's not everyone's eligible for it. Depends where your ACL has torn, and lower, closer to the bone, or more I believe in the middle is ideal. But it also depends on where the strands are facing. Right. So sometimes the strand might be pointing away but if they're kind of in the vicinity of each other and you brace it there for 12 weeks, he's shown that the strands will grow back together.
Oh, wow.
And the beauty of it is that there's no surgery, there's no drugs, there's no anything. Whoa. It's just, hey, we're going to put you in a brace, it's going to be a bit uncomfortable for 3 months.
Yeah.
And then they do an MRI. And so I think they've found it's 70 to 80% efficacy.
Wow,
it's not always a full reattachment, but it's often like a significant reattachment.
Yeah.
So anyway, I've sent a couple of people towards that, and I've mentioned it to folks on Instagram and shit who have been talking about physios and whatnot.
Yeah. And
a lot of them haven't heard of it. It's still quite a small thing. Yeah, it's new and it's happening here in Sydney. So that's my big piece. If you're someone listening to this and you're like, fuck, I got to go down this path, check out that, because the beauty of that is it doesn't cost anything. There's no surgery, no drugs. And if it doesn't end up working as well as you want to, you can always have the surgery after.
Of course.
It's fucking cool. The surgery's fucking 10 grand, right? So save yourself some coin.
Here in Australia.
That's right.
If we're talking to our American cousins, it might be 60 G's.
Fuck, it's got to be
80 grand, right? This is the thing people, I speak with people, and this is not a sales plug. This is just where you put your money, right? Let's say you were to follow the Bulletproof For BJJ program. Now, this is not saying we are going to definitely stop you from having a knee reco, but if your knees are stronger, and Joe already had strong knees before he had his, but how many surgeries had you avoided prior?
Yeah.
Having the stronger knees, investing in some equipment, a gym membership, whatever it takes for you to be getting your body stronger, it might be a couple of $100 a year, that may avoid many, many thousands of dollars in surgeries, your inability to work, your inability to live your life, and then affecting your gait going forward. So I think the idea of a non-surgical answer, that's huge.
Yeah.
So if you're out there in the grand United States of America, possibly see if something like this is available to you.
Oh man, I was listening to a podcast with him. It was actually him and his father.
Oh, cool.
Talking with another physio about the whole strategy and surgeries.
Well, let's get a link for that. We'll find a link and we'll put it in the show notes.
Yeah, absolutely.
Nice.
But he was saying this is some wild shit. He said, you go to Fiji or something, you go to, somewhere that has a less developed medical system and people with less access to high quality Western medicine. And he's like, they get torn out, big rugby culture. Yep. People tearing ACLs all the time. He's like, you can apply this bracing strategy to someone there that they don't have the ability to, the coin to fly to Sydney, to take the time to do he's like, and potentially you just fix whatever. Maybe it's a quarter, maybe it's half or 3/4 of all the ruptured ACLs there.
Yeah.
But he's like, it's huge. Yeah. I thought, wow, what a cool thing.
Revolutionary.
Yeah.
Well, part of the reason why I sound like I smoke a pack a day of cigarettes is we had a jiu-jitsu tournament on the weekend. So I was coaching, screaming, kill him, Kill him. But a good friend of ours, Samoan strongman, shout out.
Oh, he was out there?
No, but he was in Victoria, but he sent me a message saying about coaching. And he's like, I've been the one on the sideline screaming at my kid, but I realized it wasn't positive, and so I've changed that. And he's like, what's your take on that? And he wanted to ask, like, how do we feel about not just parents, but coaches who like scream, maybe helpful or not helpful advice, whatever.
Yeah.
And I am for sure a screaming coach, but I have a rationale behind this, which is the psychological warfare, because I learned this from a coach of mine in basketball in high school. And he's like, the coach's voice is the sixth man on the court, because the coach saying, they're tired. Look, he's lagging. Look, like stuff like it gets in their head, right?
Right.
I do this all the time. If you're competing against one of my students, I'll fuck you up psychologically. It's a deep man fuck. So I'll do it. I'm like, he's tired. He's stalling. I say, oh, Juiz, stalling. Start talking a bit of Portuguese. Referee can't see if I'm Brazilian or not.
Referee's Aussie. He's
But
like,
if he's-
that guy saying?
But if he's Brazilian, he's like, brotherhood. Yes. No. But
What's Juiz mean?
Like referee.
Okay.
Juiz.
Right.
Juiz. Anyway, don't worry about it. But I'm constantly going, yeah, he's tired. Look at him. And like Pierre. So we had Pierre and Mon competing.
Yeah.
And Mon is tiny and Pierre is huge and jacked. And I was coaching for both of them to destroy their opponents. And is this a good coaching strategy? Yes or no? Not sure. Because there might be, I know there's plenty of coaches who are kind of quiet. And
Would depend on the athlete.
depends
I'm
on what the
guessing.
athlete responds to. But also, I want the other coach to be scared of me.
Right.
I want people to think I'm a legit crazy person.
Yeah, right.
It's all just.
But then how does that, but then if that affects their coach, are you saying that can have an effect on their athlete?
Yeah. Because then their coach gets intimidated.
Right.
Fabio Gurgel does it all the time. He's got the biggest booming voice in the whole world. He can shout over anyone. But it's also when you're in the tournament and you're rolling really hard, you've got so much adrenaline, you can barely hear anything.
Yeah.
And the noise of the tournament, you need a loud voice.
Yeah.
And I try to keep my instructions really simple, like underhook. And people are like, no, but their opponent can hear that. Not really. Their opponent doesn't even really.
It's a good point, yeah.
You know what I mean?
The
Like-
opponent's not processing what you're saying because they're too busy listening to their coach.
And I always try to make sure that my student knows my voice. And when they're doing something good, I'm like, yes, just clapping. And that's super annoying if they just swept somebody.
Yeah.
And that person got swept. I'm like, exactly, dominate, yes. And the person on the bottom was like, fuck that guy. It is actually very effective. Now, I can't claim any of the wins of my students because I haven't been coaching recently, but I'm there in their corner and they know that. And they also know if anything's to go down, I will 100% jump in there and fight to the death for them. Not in a
Murillo Santana kind of
with a
backup.
knife. Not with a knife.
It's porcelain, no big deal.
But they know that I would go. I'm not just behind them. I would get in front of them.
Yeah.
And so they trust me that I'm like the older brother. I'm like their dad. Like I'll protect them because they're white belts. And you know what I mean. And even though they're perfectly capable of looking
Fatherless
after
white
themselves,
belts.
yeah, they need a shepherd, a loud, shouty shepherd.
So Pierre, like he's a bit of a weapon,
He's
right?
an athlete, yeah.
But he's also very different to Mon, who's like really lovely, like, super sweet.
But Mon goes pretty hard.
Well, she's a savage on the mat.
She goes hard.
But what I wanted to ask was, do they both seem to respond well to your approach?
Pierre needs a little bit more like not love.
Yeah.
Why did you do that? You fucked that up. Dude, next time I tell you do the armbar, do the armbar. Okay.
Yeah.
Whereas like with Mon, it's like, Mon, that was awesome. That was so good. Next time, I just want you to think about this. Just one thing. You change this one thing, it's perfect.
So you do adjust your approach.
100%. Like it. And
It comes as a surprise to me, and I'm sure many of the listeners.
so I don't feel like I need to adjust myself for you, Joe. You get paid for this, son. Like, you just got to put up with this shit. No. I feel like because I'm very different as a coach because I'm there for them.
Right.
I'm trying to help them as much as I can. So I guess I come to know them and I try to help them the best way I can.
Yeah.
And they're both great at jiu-jitsu, but like everyone's different. But the really good thing I learned from my old Taekwondo coach, Jeff Crane, shout out, He lives out at Lithgow, the head of Haktari Taekwondo. He would always give me 2 pieces of feedback. 1, fix this. This was a mistake. Like, even if I won or lost, he'd be like, no, come here. Straight away, I come off the mat. He'd take me away from everyone. You go away, take me quietly. And he would even replay it. I'd be exhausted. I might have won, but he'd pull me aside. He's like, no, when you're clinching and you do this, don't do that. Stop doing that. Next match, you don't do that. Then he'd also say, when you did this, that was the best. So he'd always go like, not the shit sandwich, but he would go, fix this.
It's like the shit toasty. It's like no top, just
open melt. Yeah. But he'd just go, fix this, double down on that. That was it. And he would leave me by myself. He'd be like, you need to think about this, whether I won or lost. And I keep it to that. 2 pieces of information. Don't do this, definitely do that.
How do you feel? I had someone coach me in the same way. I remember, it's happened a few times. Come off, won a fight, lost a fight, come off the coach. Hey man, let me take you through something. And then, you're down on the ground, they're showing you a thing. And I don't remember a fucking thing about what anyone ever taught me in those moments.
Sure.
Did that work for you, like getting coaching feedback right then and there?
Yeah, because it's hot. Like, it's, you come off like, fuck, I don't know why I lost. Or
right, yeah.
You might have won, but you're just so full of adrenaline. It's kind of to center you.
Yeah.
Because maybe you've only got 10 minutes or 15 minutes till your next match. So you need to be able to calm down, go through a recovery process, and really keep present in your mind what you need to do.
Yes.
Two bits of, like, when you watch a bad UFC corner.
Oh, yeah.
They got the jiu-jitsu coach going, do this, do that, do that. And then the striking coach is like, no, do this. Head movement.
Yeah.
Like, they don't need coaching in that moment. They probably just need a bit of reassurance.
Yeah.
That's really it. And it's different, obviously, with the UFC because they have multiple rounds and that can change the fight if they psychologically crest something or you're down, you need to win, knock him out right now.
Yeah.
Like
there's a time and place for that kind of intensity in the corner.
Yeah. And I think it's the reassurance is a big thing. And if the person is used to hearing your voice, that helps. That's my caveat. And part of the reason why I just scream. I mean, I'm using my diaphragm. Obviously I've had operatic voice training, but at a tournament, you got to go hard. And I do often yell like...
It's a real skill of yours. I'm not, I can't be that person. I'm not a yeller. I'm not like, I don't coach in that way. I'm real passive. Yeah. Like I'm not a great coach. I think, especially in jiu-jitsu, it's not my thing. But so I do think it's a real skill that you have to be able to go there and be that person for them.
But it's in no way is it trying to be egotistical because I don't think, I'm the best coach. But I do inject myself into the situation a bit because I want every other person who's going against my guy or girl to be a little bit scared of them and very scared of me.
Right.
Like, you're going to get on the mat with one of mine, they're going to fuck you up. At least you think that, even if it's not true. Maybe you trounce them, whatever. But that's psychologically going in, you're like...
Kids division on notice.
I'm going to be coaching...
Kids like screaming, running from the arena. Yeah, leave.
I'm going to be coaching Leo, Joey's son. Yeah. I'm like, do your father proud. Yeah. It's just one of those things. It's like, to my students, I want them to know I'm their best mate and I got them no matter what. Win, lose, doesn't matter. But in terms of it being a competition arena, I want opponents to think they're going to lose and know that I fucking hate them. And then maybe if...
Respectfully.
No respect. No, a little bit of respect. But no, it's one of those things. It's partly an act. If you know me, I don't mind. Like, the thing is, over time, they become your friends. Your opponents become your friends. It's all of this. But in the heat of the moment, it's funny how that psychological thing can really tip the balance if two opponents are equally matched.
Yeah.
And I've seen that at the highest level, that the coach and the coach's demeanor, not getting too wild, but just being loud and strong and insistent it can affect the match. So that's why I sound the way I sound. But yeah, man.
Fair call.
I think it's like one of those things that helping more people with their jiu-jitsu has made me think a lot more about how my students think about jiu-jitsu to try to steer them, manage their psychology.
So then coming back around on that to Simone Strongman.
Yeah, sorry, because he was like, I don't like shouty coaches.
Right.
I don't want my kid to think this is kind of I'm paraphrasing here, so shout out. He's like, I've stepped back a bit. I don't,
because he's a bit too intense.
yeah, maybe.
Yeah.
And fair play, because it's a father-son thing, right?
Yeah, it's
Which is
different for a parent, I do think.
And his son did quite well at the tournament recently, but he's like, he felt that watching his son compete inspired him to want to train more, compete more, and go the path, which is really cool. It's a cool relationship. And I think based off what I heard Hoyler Gracie say about his father, that his father said, look, if you win, I'll give you like $5. He's like, if you lose, I'll give you $10. I was like, what? That's why? He's like, because it doesn't matter. Like you shouldn't feel like winning is the most important thing. I want you to just know that I support you.
I don't want to sound cynical, but I find it hard to imagine Elio saying that.
No, he wouldn't.
Hey, the Gracie family were like pretty indifferent towards losing. I'm like, no, they were highly competitive.
Go and kill that guy. But
that's right. Your family's fucking legacy rides on this.
On your shoulders.
Piece of shit, win this match.
Yeah, you're
or
7
leave.
years old. Yeah. I'll smother choke you. Yeah. But I mean, he sounded
It's a nice sentiment all the same.
He sounded genuine when he said that. But he was saying that knowing that his father supported him and loved him regardless, made him bolder. Like, it made him want to compete. Because he's like, actually, it's just me wanting to win. Doesn't matter what Dad thinks so much. And he was the most achieved in, gi jiu-jitsu out of that family. So, yeah, I don't know. I mean, I don't know what I'll be like as a dad. I mean, I have been checking out prices on bears. I feel like Russian economy's hurting right now.
Yes.
They've got some bears for sale.
Fucking hell.
I mean, I would keep it fair.
You're up in the Blue Mountains. Haven't you got some wild shit up there you can get your hands on?
Yeah, I mean, there's rumors about the Blue Mountains panther.
Koalas or some shit?
Yeah, drop bears.
Yeah.
No, but see, I think, a declawed bear's cruelty, right? So you don't declaw the bear, you put boxing gloves on. And then my child isn't allowed to use striking, but the bear is. Still muzzle it so it doesn't bite the child.
I saw a fucking video the other day. I can't remember who posted it on Instagram of two bears fighting.
Oof.
And one of the bears slapped the other bear.
Yeah.
You couldn't even, it was so fucking fast, you couldn't even see it. It was like, and it was like, and like, it was like the sweat flying, like they were a bit wet. The sweat flying off like when you see, boxing in a movie. Yeah. But I was like, holy shit. Like it would have just, your head would have just left your body and been elsewhere.
Yeah.
Anyway, I think it's a great idea.
I feel the Khabib. I feel the Khabib model has been proven to be effective.
I think that was what is it? The bear had been fucking tranquilized with some shit.
No, well they declawed it, which is fucked up. But also you have Khabib as a 7-year-old kid or 6-year-old kid, and his father being like, take that bear down, take that bear down. It was a young bear. It wasn't a fully grown bear.
Yeah.
So it was just kind of playing like, I don't know what's going on here. I'll just play. And Khabib's like, you don't want this. I need to be champion.
Please.
At 7 years old.
Please stop.
Stop now. You don't want this. But yeah, man. I mean, anyway, it's just funny these thought processes we go through.
Before we wrap up, should give a little update on our app.
Oh, yeah, man.
Guys, things are coming in hot. We've been working so fucking hard on this.
Yes, sir.
So right now it's, very end of November. App is, we're in almost in the last phase of testing. In about a week, it will be in the hands of a select group of users who are going to give us final bits of feedback.
Yes, sir.
And after that, once we've made changes off that, it will be in the hands of you, the good people. We'll put that thing out there on the App Store and whatnot, get it through the website, all that shit. So it's probably, our goal is to get it out before Christmas, right?
Yeah, definitely.
So let's see. We're fucking working hard on that, but we also don't want to release something that has any kind of, like if there's something there that we're not happy with, we'll take the extra time to make sure. But end of the year, the app will be available. It's going to be fucking sick. It'll be free to start using. Heaps of programs in there. I can't wait to get this thing out. It is a real sprint here at the finish line.
Yeah, no, I spent 5.5 hours yesterday building. And, I'm not the most tech savvy person. Oliver's helping me, just pumping away, just sitting there, just programming. Like when I say programming, I mean literally like not as in coding, as in this exercise, this many sets and reps, this prefix, blah, 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 and just putting it all together. And man, I went and checked last night. It was all gone. And I was like, got straight on the dev chat. Boys, I spent 5.5 hours on this. Where the fuck is my work? Like, you better not have, oh, we're working on it right now. Don't worry, it's saved. Yeah, it better
Their
be.
responses were very short. Work will be saved.
Working on it now.
Yep.
Can you do a Skype chat tomorrow?
Yep.
Boys, like, I can't, you might have experienced this where you've written an essay and then accidentally hit delete or something. And you're like, undo. So, fingers crossed that work is safe. But we are working our asses off to make sure when it gets in your hands, you guys are going to love it.
Yep.
Because that's what we want for you.
Thank you for listening. If you're watching on YouTube, please like and subscribe. Helps grow the channel. If you're on a podcast app, give us a subscribe there. We appreciate it. 5 stars, all that shit. See you next week.
Peace.